Millions of Americans receive hospice care during their last days. In fact, there are more than 4,300 hospice providers nationwide. And CDC numbers show that a little less than 40% of those are nonprofit. Here in California, the nonprofit hospice providers are joining forces. We're joined now by Jan Jones, who is the CEO of the Elizabeth Hospice here in San Diego. Welcome.
Thank you. It's a pleasure to be here.
So tell us, what is the vision for the California Hospice Network?
The California Hospice Network was formed, actually 3 nonprofit programs came together to form the California Hospice Network so that we could join forces to create a network of nonprofit programs serving our local communities, keeping our local flavor so that we continue to be community oriented as nonprofit organizations, but we also benefit from consolidation. Many businesses these days are consolidating to create economies of scale, to create best practices. That's really why we wanted to form the California Hospice Network, to gain economies of scale and to also encourage best practices amongst us.
And when you talk about best practices, what elements need to be in place for quality care?
Well, there are certain basic quality measures that we must all agree to provide and show evidence of. But we want to go beyond what's basic. We want to go beyond. So for purposes of measuring quality, we are accredited by an outside accrediting body, in our case, Joint Commission. And so that's one measure of quality. But we also want to be able to benchmark against each other and to share our best practices so that if one of us is doing something that seems to be really serving the community better, then we all want to follow that track. And so it's really an opportunity to work very closely together to improve quality for all the patients that we are blessed to serve.
And speaking of that, you mentioned that you've been in the healthcare industry for a very long time, but hospice care is very unique. Can you talk about the difference when it comes to providing the quality care for hospice patients?
Right. Hospice care is really a system of healthcare delivery that is very much patient and family oriented. We have an interdisciplinary team of individuals, nurses, doctors, social workers, chaplains, personal care aides, and volunteers who make up a team to deliver care to the person who is living with the illness as well as their family, so that their last months can be as productive as they choose them to be, and they can live their lives in the manner that they choose. And so we coordinate and manage the care, all of the care, for that person during those final months. And it really is the person who's directing us as to what that care would look like.
How will the individual hospices, as they start to join the network, become stronger?
Well, the strength will be in numbers, the fact that we will have more programs, more opportunities to consolidate back office costs will strengthen our ability to invest more in programs that are being delivered in the community. So that's a strong message. Over time, the way in which we are paid for the services that we provide by Medicare and other insurances is expected to change, and so we need to be prepared to be at the table with the payers to be able to continue to provide the kind of service that we provide. So by joining forces, it gives us an opportunity to have a better seat at the table.
And speaking of a seat at the table, any expectations that this would also lead to advocacy work?
Absolutely. We always want to be promoting legislation that would positively affect people who are living at the end of their lives. It's very, very important that this kind of specialized care continue to be available for everyone. I want it available for my grandchildren, for their grandchildren, because it's so specialized and so unique and so individualized, and that needs to be there. So advocacy definitely will be something that we will be thinking about.
Jan Jones, CEO of Elizabeth Hospice in San Diego. Thanks for your time.
Thanks, Ebony.